Guys, welcome back to Medical Coding with Blue. Today's episode is all about, do you have to select a specialty to code as a medical coder? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I got a message on LinkedIn from a lady that was asking about what did I think about coding for OBGYN, because she's considering specializing in OBGYN coding. And this other person messaged me on YouTube twice, the same message. Don't do that, guys. I get the message the first time, okay? But the message twice said, I'm an RN BSN with 7 years of NICU, that's a neonatal ICU, experience. Years ago, I completed a medical coding levels 1 and 2, and I really enjoyed it. And now that I've left the bedside, I am considering moving to the medical coding field full time. Is it possible for me to specialize in coding for the NICU? So when it comes to, I want to specialize in this, I always tell medical coders and medical coders, we're not doctors. You know how doctors have to pick a specialty, or they want to specialize in a certain thing and not just be so all over the place. They pick a specialty and they study it. With coders, you have to be prepared for anything. It's not just about, oh, I've got to pick a specialty. I don't think that that's good to pigeonhole yourself into one specialty, especially when you're new. You don't know where you're going. You don't know where you're going to find your first job. You don't know who's going to allow you to have that first opportunity. And when you narrow down, your specialty that you only want to code, you're going to miss out on a lot of opportunities, especially being somebody that's brand new. Or if you're thinking that this is the only thing I can do because I have experience, like this nurse. I only have experience in the NICU. Should I specialize in that? Can I specialize in it? As somebody who took the Coder 1, Coder 2, they should know the answer to that. However, the thing about it is that when you are out there as a brand new coder, you need to give yourself all the opportunity to be able to learn everything, not just a certain specialty. Now, yes, I have worked in orthopedics and podiatry for the last few years, all right? But I always give myself the opportunity to be able to code for anything. And I've been given a lot of opportunity to code for other specialties as well. It keeps you sharp. It keeps you well-rounded. It keeps you with being able to get those opportunities to do other things. I've coded for same-day surgeries. I've coded for all of these other things as well. So I'm not limited in my career choices. And if you're thinking that, oh, I need to get the specialty certifications, if you're looking at the job listings, you'll see that no one's asking for those specialty certifications, like for the ER or for OBGYN or for, orthopedics or anything like that. They're not asking for those specialty credentials. They just want you to have one of the 4 main medical coding certifications, the CCS, the CCA, the CCSP, or the CPC. Any one of these 4 and they will be happy, right? Because this says that you've been trained on everything, that you know everything, that you have been tested, your competence you can show on all of these different specialties. There may be some specialties that you don't like. There may be some specialties that are a little bit more of an effort for you as far as like you wanting to code this or not, I had a hard time when I was coding for ICD 9 times. I had a very difficult time with OBGYN coding. Now it's not a big deal, right? For me, but back then it was very difficult. The rules and everything is just different sometimes with different specialties. But again, only limiting yourself to a certain specialty because that's what you code for, it's especially when you're brand new, it's not a good thing, because it's not just that specialty, right? So for instance, myself working in orthopedics, I see patients who have all kinds of conditions. So it's not just that they have an orthopedic condition, but they also have they'll have diabetes, they'll have hypertension, they'll have chronic kidney disease, they'll have heart disease, they'll have all of these things, osteoporosis. These are all different things that can affect the body, because the body is not just one system. It is a bunch of different systems that work together. So again, only thinking that you only need to specialize in just one thing is going to limit your abilities to learn a lot of other things, because one body system can affect many body systems. And having that knowledge and knowing that is going to be able to allow you to be able to code for anywhere, right? And so for myself, I could code for the internal medicine side. I can code for, let's see, what else? Cardiovascular. I can code for that as well because I've seen their diagnoses. I'm not limiting myself to just only orthopedics because I know that other things can affect the bones. If the patient is smokes, that's also a problem because that can affect the bones and healing time and things like that. Again, that's your vascular system. So those things all work together. And knowing that, again, is going to be able to give me lots of opportunity. And I've said in the beginning of my channel and all through my channel that some of the best places that you can start to work as a coder is the ER, is family practice, is orthopedics, because you see a lot of different things, particularly with the ER and with family practice and urgent care. You will see a lot of different things. So you'll be able to get that exposure to mother baby, to orthopedics, to cardio, to neuro, to all of these things. So that way you can decide, hey, I really take a liking to coding for cardiovascular. Let me learn more about that so that I can get, a chance to code for, the cardio clinic. That's a good way to do it. But again, coming in thinking that you need to pick a specialty, we're not like doctors, guys. You don't have to do all that. And investing in learning is one thing, but investing in all of these credentials when you don't have experience to back it up, that's something completely different. Or especially if you think that that's what's going to get you hired faster, that's what's going to make you more money. That's not the way that it works. The way that it works is that the more knowledge you have, the better off you'll be, because that will make your accuracy better. It will make your accuracy a lot higher. Your code selection is more sophisticated. But if you are just looking at it like, well, I've been in the medical field before, I did the NICU, and that's the only thing that I want to code for. Again, you're vastly limiting your abilities to be able to have opportunities. So I strongly recommend that you don't do that. And to the same thing to the lady that was asking about OBGYN, it is good that you want to code for something like OBGYN, but that should not be the only thing that you're looking at. If that's your first exposure into coding, then sure, coding for OBGYN, that's great. But always be receptive and open to coding for other specialties. And don't waste your time with these specialty credentials, because again, who is asking for that? If you're looking in the job listings, you'll see that they're asking for the CCS, CCA, CCSP, or the CPC. They're not looking for these specialty credentials. The specialty credentials are just that. They are just credentials that it's part of a business plan. I code for orthopedics. I code quite well for orthopedics. But you don't see me certified specialty for orthopedics. I can just say that in my knowledge. I can show that and demonstrate that when I'm taking an assessment test. That's what I can do. So again, it's not necessary to distinguish yourself as, I'm a OBGYN coder because I got the OBGYN certification. It doesn't matter. You're already tested on OBGYN, in peds, pediatrics, when you are tested for your medical coding certifications. So that's something that you guys got to know. It's not as deep as you might think it is. It's more about getting your knowledge and getting that up to speed before you start thinking that you want to do any kind of specialty coding. Now, I love orthopedics. I have no problem being in orthopedics, but I also have no problem being anywhere else as far as like coding for other specialties, because again, I'm not going to limit myself to just one specialty, because again, the body's interconnected. You're going to learn about all these other things. And I think sometimes people try to make it just so one way and so like one single path. And that's not the way that it is, especially with coding. And you can't say that I don't know this because I'm not a that coder, right? I'm not an ER coder, so I don't know about all that. Can't say that. Just because somebody works in the ER, they just work with different codes on a regular basis, but it doesn't mean that you shouldn't be able to step in and pick it up. Okay. Now getting better at coding for a particular specialty is always a great thing. When I got pulled out a few years ago of orthopedics and I got put into pulmonary because they were drowning and they needed help, that was the reason that I got pulled in, because I'm a researcher and because I look and I dig and I find things out and things like that. I had not been ever done pulmonary clinic coding, but I had done pulmonary patients. I had coded for pulmonary patients when they were up on the floor, but not in the clinic. And so that was a new experience for me, but I went there and I did it and I learned it and I did my research and stuff. So that's part of being flexible and in coding, is that you have to be willing to do all those things and not be so only one way. I only want to do OBGYN. I only want to do, the NICU. And not every hospital has that equipped. They're not all like that. Some are very small and they may have only a small unit and they have to send that baby off to a children's hospital or something like that in order for them to get better care. So again, you're limiting yourself if you're only saying, I only want to do this type of coding, okay? And depending on how far back you have learned coding, if this person didn't say about the nurse that went to coder 1, coder 2, they didn't say if there was ICD-9 or ICD-10, but of course we're in ICD-10 and it's different. The coding is a lot different from ICD-9 times. And if it's been a few years, you will have to review. You will have to study again and go through all the books and get it to come back, because it will come back. Obviously, if you did good in it, it will come back, but it's not something that you can just walk into lightly. This is something that you will have to build this over time. You will have to build that knowledge up. And again, that's just the best thing. And when you get tired of coding for one place, you can always go and code for another type of specialty. That's why I say for new coders, when they're getting in, coding in the ER is going to let you see everything. It's going to let you see those gnarly accidents. It's going to let you see mother baby. It's going to let you see those colds and things like that, and all of those basic things that come in, like lacerations and things. But you're going to get that exposure on how to start coding those kind of things, even though you're not in that particular clinic, but you're starting to get that exposure to that specialty, so that way you can explore your options. And the same thing for family practice. Family practice, you see everything. Preventative medicine, you see all kinds of things. But that's just a good way to get a lot of different exposure. And then after a while, you want to go to a certain specialty and you start learning and you start digging more deeply into that specialty, learning about the disease process. That's a good thing. That's going to set you up for success. But again, unless you work in a place that has all of that, those specialties that you want to work in, again, you're going to vastly limit yourself, and you don't want to do that. You want to be the type of coder that's going to be able to code for anything. When I first got here to my forever home, my boss at the time, she was talking about shuffling some of the girls around. Well, they were saying that no, they didn't want to do that because they're so used to their clinic. And she told all of us something I'll never forget, which was, you're a coder. You code anything. You should be able to be dropped in to a clinic and spend a few days learning it, and then you should be off and running, because you are a coder. You are a certified coder. That means you are competent enough to do all of this. And just like I'm going to tell all of you, you are competent to do more than one thing. You are competent to do more than one thing. And again, don't put yourself in a box that is going to be just limited. I am not limited, even though I am a very good orthopedic and podiatry coder. I am not limited at all. And I refuse to let myself be limited, because there is so much out there. And the attention to detail plays a big part of working in any specialty. But you get really good with that and you start building your skill on that, there's nothing you won't be able to do. And your earning potential, for some of you that are very concerned about that, will go up. We don't talk about money specifics on my channel, and I never have, never will. But it's different for every place. But like I said, the more knowledge that you have, the more that you can demand as far as your salary wise goes. But it's not about tying it to credentials. It's about actually tying it to experience. And I've said before too, is that when you're out there and you're applying, you apply for every place that's looking for a coder, even if they're asking for 3 to 5 years of experience. They're always going to ask for 3 to 5 years of experience because employers are lazy. They don't want to train. The vast majority of them do not. Some of them do want to train. Some of them do have their own training programs, which I think is fantastic. But, you know, it really all depends on the facility. And a lot of times people don't understand what we do as coders. They don't understand our purpose. But for the ones that do, that's when you can start seeing, okay, this is their data and their statistics look really good because they understand the importance of coding and why cross-training employees is really important too. It's not just about, only having a really good coder here and a really good coder there. You have to have strong coders everywhere who can pick up the slack to code for anything. Because when you start doing that, when you start specializing in one thing and you don't want to do anything else, it makes you fearful to be able to try other things. And that's the worst kind of thing to have, is because that's going to lead to so much unnecessary wait time with the coding, because now you don't want to do anything else except for your specialty. And that's ridiculous. You can't do that. You have to be willing to be open to try other things, even though it's new. That newness is going to wear off in just a few weeks and you'll be all like, okay, yeah, I got this. Because the fundamentals of looking up codes is the same. And the fundamentals of starting anything new is the same. You start off with the coding guidelines. You read that particular section of the coding guidelines, and that'll tell you how to code for those diagnoses. Then you get to that section of your ICD-10-CM book, and you look through that particular chapter, and you read all of those notes. You read all of the guidelines for obviously those notes, those chapters that you're in, and that way it'll better help you. If I was to give advice to somebody who was starting off in orthopedics, I would tell them obviously to read the orthopedic guidelines, and then to read about the musculoskeletal chapter, to read the chapter on the injuries, and to read the chapter on the external causes. So that way all of that can be, okay, we've got that figured out. Now we can look at the book. Now we can check out the CPT section, the musculoskeletal section of the CPT, and to be able to look at what it is that we're doing here with this. And that's how you do your foundations for anything. For learning anything new, you have to do that. That's your first stop, is to read those coding guidelines. You got to look at everything. Then look at the chapter in the book. So that way you can find those extra hints that will help you. And you can't always rely on other people who even have been in that clinic. Because sometimes people who have been in that particular specialty for a long while, sometimes they know a lot, and sometimes they have just gone along to get along. And so because they go along to get along, sometimes they don't know a lot about that specialty. I have seen that. I have seen people who do that. They've coded for a certain specialty for years, and they still don't know. They still don't know because they just try to do the same thing over and over. And then when it comes out, okay, oh, well, I didn't know this, I didn't know that, then they have to correct things. So that's the thing, guys. You have to learn to do research for yourself. You have to learn when to ask questions and verify. I always tell people, if I tell you something, verify it. Go and verify it yourself. So that way you can see. Don't sit here and argue back and forth with me, because I've given you probably the reference, probably the whatever coding clinic or whatever it is, CPT assistant, something, and I've given it to you. Now it's your turn to go and look it up. That's what makes coders strong coders, instead of weak sauce coders, right? That are just, oh, well, just tell me what the answer is, and then that's it. No, I'm not going to give you the answer. No one will give you the answer. We are responsible for everything that we do. Do we help each other? Absolutely. But there's some people that won't, because no one helped them. Okay? No one helped me, but as far as like when I got into my first job in coding, no one helped me. I worked at the Cancer Therapy Research Center. No one helped me, because we were all learning, all together. But it wasn't something like you're not taught You have to teach yourself when you're on the job. And so that's very important. Yes, you can find mentors, and yes, you can find people who will be very happy to help you. But you also have to make sure that you verify that advice. And there's nothing wrong with that. But to go back and forth with the person is disrespectful. I'm just saying, especially when they're trying to help you out. But with that said, this is a wonderful field that will give you lots and lots of opportunity if you do not pigeonhole yourself. And if you are presented with a challenge, you say okay, and then you take that challenge and you run with it. You run with that challenge. Don't let the fact that you're starting in something new make you question yourself, make you question your knowledge or anything like that, or your abilities to be able to do anything. Because again, that new feeling, that unsure feeling, that uncomfortable feeling of not knowing is only going to last for a couple of weeks, maybe a few weeks. But again, if you're doing those steps, reading the coding guidelines for that particular chapter for that specialty, going and looking in the book at that particular specialty, as far as like in the tabular section, so that way you can look at those notes and things like that, that will get you more familiar with that particular specialty. Look online for if there's a organization or association for that specialty. When I got put into the pulmonary clinic, the first thing I went to was the American Lung Association. I wanted to know everything that they had, all the resources, and they had lots of resources there. So and that's what I did when I started to do my research so that I could get better with that particular specialty. But again, it just takes a little bit of research and looking at your books and looking online, so that way you can get all of that information, because no one's going to hand feed you that information, guys. No one. You have to learn to do this. You have to learn to find out where you can get those resources at. Again, it's just my advice anyway. I want coders, especially the new generation of coders, to come in. I want them to be strong, and I want them to be able to be knowledgeable, not just, oh, we just went through a fast-paced coding program and we don't care, and we're just going to put these people out here and call themselves a coder. No. I want people to be able to say, well, this is the guideline for this, and this is where we can find this answer, and this is where we can find that answer. That's the coding future that I want. Not that, oh, well, it's all going to be all AI. No. If you're saying that, you clearly don't know. You clearly do not know. Because for all of its, oh, we know this, we know that, it cannot critical think. AI cannot critical think. That's where we come in. And that's why critical thinking is so key. Okay, it is very key in this industry. I'm just saying. So with that said, I'm going to wrap this one up. Best of luck to you out there, guys. Apply. Don't pigeonhole yourself. If you're going to learn something, learn everything. Okay? If you get put into a specialty, look at those specialty guidelines. Look in the chapter in the book. Then look in the chapter that's relating to it in CPT as well. Go online, find external websites that you can go to, so that way you can get that extra information. I'm just saying. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.